A very good evening all. I am Aditi Lamba with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin the episode by taking a look at the coronavirus pandemic and its impact. Globally, we are looking at more than 91.8 million cases of COVID-19 with nearly 2 million deaths. In the United States, we are at 22.9 million coronavirus cases with more than 381,000 deaths. The nation is ravaging with coronavirus cases, hitting record numbers of deaths and hospitalizations. In states California, Arizona, Nevada, and Georgia, most hospitals are reaching capacity in hospital beds. This has overwhelmed the already fragile healthcare system, and doctors and nurses are facing overburdened emergency rooms and intensive care units. Texas has now become the second state after California to surpass 2 million COVID-19 cases, reaching a grim milestone in this pandemic. ICE continued to be on the vaccine rollout, which is currently slower than anticipated. Officials want to accelerate the delivery of shots to more people. If you are a medical professional or a healthcare worker in hotspot states, please write to us on your experience on events@itvgold.com. We are also calling on South Asians who have been vaccinated to share their stories. Meanwhile, in politics, the House voted to impeach President Trump a second time. Democrats are charging him with incitement of insurrection for his role in last week's deadly Capitol attack, which left 5 dead, including a police officer. 9 Republicans said that they will vote for impeachment. So how should we analyze this deadly attack on the Capitol by pro-Trump mob, and how should we be handling the ongoing surge of COVID-19 cases? We speak tonight with doctors, officials, activists, and community leaders. Here are the headlines. Dr. Rachana Kulkarni addresses COVID-19 surge and vaccine rollout, New Jersey. Black Lives Matter Greater New York frustrated over police response to pro-Trump mob featuring Chivona Newsome. Federation of Indian Associations present Virtual Gujarat Conclave 2021 Investment and Tourism featuring Indian Chief Minister Vijaybhai Rupani. A lot more on the other side of the break. Stay with some Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba, and this is Vision of Asia, Wednesday night episode of South Asian News. We continue now to reflect about last week's mob attack at the Capitol and a stark comparison between the treatment of Black Lives Matter demonstrators from last year versus the now called domestic terrorists who stormed the U.S. Capitol. Many are calling this a deadly assault on American democracy and a reminder of a deep-rooted systemic racism impacting Black and brown voices differently than the predominantly white mob which attacked our Capitol last week. Today, the U.S. House of Representatives voted to impeach President Donald Trump for inciting this insurrection. This Democratic-led effort, which now won passage with some Republican support, makes President Trump the first sitting U.S. president to be impeached twice. Senate Majority Leader Mitch McConnell has rejected Democratic calls to convene the Senate in an emergency session to begin an immediate trial. Meanwhile, many Black Lives Matter activists have also called for the impeachment after seeing the difference between how law enforcement treated the mob compared to the police treatment towards BLM protesters, which saw tear gas, batons, rubber bullets, and much more towards the demonstrators. Bringing more insight into this, we spoke with co-founder of Black Lives Matter Greater New York, Chivona Newsome. Here is Chivona. Yes. President Trump also said last year that when the looting starts, the shooting starts. We saw looting at the Capitol. How do you react to those kind of statements that came from the president and the lack of law enforcement that was used at the Capitol?
And it's so simple, what I'm going to say. It's a aha, I told you so. Black people before me, since Malcolm X and all the other rights leaders, civil rights leaders to come, have been saying Black people are disproportionately affected by police presence. We call for the abolishment of police in our community because we know that we are killed and arrested at a higher rate. You see how I've seen it throughout my time in activism. Police sometimes don't even want to arrest white women. So let alone this country was designed and built for white men. This is how America gained its rights and freedoms away from Great Britain. And this is how they continue to take things by violence. They suppressed many people, held people in slavery through violence. So with Donald Trump being their loudest speaking piece, who seems to represent them at this point, Nothing he says shocks me. He saw the images coming out. He saw people putting feces on walls and sitting in Speaker Pelosi's desk and people smoking weed and vandalism and looting. But he would never condemn his own kind because it's who he is. He is a white supremacist.
Chivona, what kind of news are you hearing right now? Because you are an activist, you're really involved in the community as well. What news are you hearing about the inauguration day? There's a lot of threats that are being done to the capitals of this country right now. They're under threat. How are you all looking at this?
We are in safety protocol. As you know, because of Donald Trump, when he threatened my brother this summer with treason and sedition, honestly, we've received thousands of death threats. So as of right now, when we take to the streets, we are wearing armor. We have security with us. We are moving in a certain way, and we are in heightened alert until the inauguration. What I've been being told in the activist circle that the other side, the white supremacists, are planning to hold an armed march. We have no actions planned down there because if the reports I'm hearing are true, which I hope they're not, it could be a bloodbath at a United States inaugural.
What do you think the administration, the current administration, needs to do right now?
I think that Pence needs to enact the 25th Amendment because I'm unsure of the timeline of the impeachment. But the FBI is also putting out reports that if we snatch Donald Trump out of power today, say Pence enacts the 25th Amendment, cabinet members vote to remove Donald Trump from office, that can lead to armed protests in the streets. If people hadn't ignored white supremacy and white militias, we would be better equipped. I'm hoping that the current administration and the armed forces are gathering the National Guard and have our military on high alert for the inauguration. And I hope that they are looking into any and all possible threats. As we've seen, this is the second act of domestic terror in America in under a month. In Nashville, Tennessee, on Christmas Day, there was also a van, RV van explosion. So we see the climate escalating, and I hope that our military and our federal government has the right security measures in place.
How do you think the law enforcement needs to react to a mob if it happens again?
Aggressively. Meeting a mob with force aggressively. They need to pretend that everyone walking and everyone moving and mobilizing, pretend that they're Black Lives Matter activists. That would be the proper response. You've seen my marches. I've had the pleasure of having you cover it. There's tons of police presence as far as the eye can see. They're usually a helicopter or two above head. Officers are dressed in tactical gear. So pretend that Black Lives Matter Greater New York is planning a march on Washington, and that would be the appropriate response for white armed militia men.
You know, Chivona, while I have you here, I have to discuss the path moving forward because a lot is happening here, and I feel that the BLM protests will never stop until a big change is made. A new administration is coming in. How are you looking at them right now? What are your expectations?
As we've seen through the numbers that happened through many elections, specifically this one, Black people played a huge role in electing Democratic leadership. Now we need policy and legislative change. President-elect Joe Biden gave an amazing speech a day or so after the terrorist attack last week, and he talked about the same things that we were talking about in terms of how BLM protesters are met with a response from law enforcement. But this administration can do more. They ran on a platform of equity and justice for Black people. So we need things like the Blue Wall bill being passed. And that is the federal prosecution of law enforcement who falsifies police documents. That'll help in breaking down that blue wall of silence that stops people from prosecuting, that stops governments from prosecuting officers who murder and kill Black people. But a little bit more than that, the police are not Black people's only problem here in America. We need adequate housing, we need food, we need shelter. And as we can see from this global pandemic we've been living in for almost a year, we need a lot of help, and our communities are hit the hardest.
We have now a cultural event that brought together South Asian leaders and officials virtually during the pandemic to focus on bilateral relationship between Indian Americans and their motherland. The Federation of Indian Associations, FIA, is one of the largest organizations that caters to the needs of our community with access and resources, as well as building coalition between members of the diaspora. On that, recently the Federation of Indian Associations presented Gujarati Conclave 2021 virtually to discuss investment and tourism in India. The event was in collaboration with the Gujarati Associations of North America and the Consulate General of India, New York. The successful virtual event saw Indian Chief Minister of Gujarat, Mr. Vijaybhai Rupani, Indian Consul General, Mr. Randhir Jaiswal of New York, ITV Gold Parikh Media's Chairman, Padma Shri Dr. Sudeep Parikh, and many prominent South Asian American leaders and supporters. Here are some highlights from virtual Gujarati Conclave 2021.
ગુજરાત દેશનું ગ્રોથ એન્જિન બન્યું છે. છેલ્લા 10 વર્ષમાં ગુજરાત 10% દરે વૃદ્ધિ કરી રહી છે. જ્યારે નાણાકીય વર્ષ 2019-20માં જીએસડીપી નો વૃદ્ધિ દરનો આંક 13% નોંધાયો હતો. નજીકના ભવિષ્યમાં આ વૃદ્ધિ દરમાં પણ હજુ વધારો થશે તેવી મારી અપેક્ષા છે. ભારતની કુલ વસ્તીના ફક્ત 5% વસ્તી ધરાવતું ગુજરાત ભારતના જીડીપીમાં 8% હિસ્સો ધરાવે છે. સમગ્ર દેશમાં ગુજરાતમાં બેરોજગારીનો દર સૌથી નીચો એટલે કે 3.4% છે. આ પ્લેટફોર્મ પર આ વાત શેર કરતા મને ખૂબ આનંદ થાય છે કે સમગ્ર દેશમાં સૌથી વધુ એફડીઆઈ મેળવવામાં ગુજરાત નંબર 1 છે. તે પણ ફક્ત પાછલા વર્ષ નહીં, પરંતુ છેલ્લા 2 ક્વાર્ટરમાં પણ ગુજરાતે સૌથી વધુ 1,19,000 કરોડ એફડીઆઈ મેળવ્યું છે.
It is a diverse state that consists of not only Hindus, Muslims, Sikhs, Christians, Parsis, Jewish, all claiming to be Gujaratis and hailing from that state. Once again, thank you very much, and I look forward to learning from all the distinguished leaders on what is it that Gujarat has to offer to the world. Jai Hind, God bless America.
We are shaping New India with the futuristic infrastructure. So I would like to highlight that the DFCs, 36% passes through Gujarat, that Gujarat has invested in developing special investment region and special investment clusters alongside this DFCs. And we, to provide the last mile connectivity, we have decided to connect all the existing port to the DFCs. We have the IFSC, first of ever kind of financial services center city in Gujarat. That is India's only hub with world-class infrastructure for international and offshore transaction. So basically our focus is to house the industries relating to financial services and IT industries.
Today India is exporting soya, rice, wheat, pulses, and various peanuts. All kind of agriculture outputs are much high. Similar way, horticulture also India is taking place. In a word, we were importing a big quantity of various kind of horticulture, and today India is exporting. So India is a consuming economy as well as provide the export platform, and Gujarat is well placed because we have 8 active ports and new 6 ports are coming. And due to the new labor policy, which is very friendly, and you can, I think, hire a people at very competitive cost. That is the main thing, to reduce your cost.
I must recall the visit of Governor of New Jersey, Governor Phil Murphy, to Gujarat in 2019, September 2019, which we facilitated. Consulate General of India worked with the Governor's office in organizing that visit. We can organize many more of such interactions, but of course we will need your support. I'm sure you are there, and we need to work together in promoting Gujarat-US relationship as well.
For those of us who are elected, and those of us who are younger and elected, we can only do so because of the immigrant generation that came before us, because of you, because of my parents' generation who came to the U.S. And survived and now are thriving. And that is very important. And now, our community is overall doing well. Obviously, we're, in the midst of a global, economic and health crisis, but, our community is doing well. And one of the things that, when a community prospers, we as the diaspora, must also look to, our native land, India.
Honorable Chief Minister Rupani ji, Deputy Chief Minister, Honorable Deputy CG Satrughna Sinha ji, and distinguished guests and dear friends. As a founding member of Gujarati Association of North America, it's my privilege and honor to host this webinar in conjunction with the FIA. Today, we are going to discuss the artificial intelligence and its role in the healthcare industry in India. Artificial intelligence involves the use of the computer software that can assess, critically analyze, and interpret data similar to the human being. We currently see artificial intelligence in many industries to optimize efficiency and reduces the cost. Healthcare is an area that affects all of us personally and is an industry which in the US is the size of the entire French economy. Healthcare also has unique challenges of access with the many physicians and health centers in the large cities, increasing cost, and need to address a growing and aging population.
How artificial intelligence can help us is that right now, one issue is improving access. So both in the US and India, many patients from rural areas or due to crowding and now with many COVID restrictions are unable to come in and be identified to seek care when they need it. What artificial intelligence can do is bring care outside of traditional clinic, and maybe from smartphones or certain centers, patients can be identified easier without the need for an in-person physician or nurse. And this can help identify at-risk patients and bring them into care, both reducing costs and hopefully also improving care.
I know that when I go in to film a travel TV show, because our shows are all about putting locals on camera, they guide us through the area and share the history and the culture. And Gujarat has so much of that to express and share, everything from the culture and cuisine and festivals to the Buddhist circuit and UNESCO World Heritage Sites. And those are the types of things that it's amazing to understand when you share that content and information with the world. They want to go and travel to India. They want to travel to Gujarat. They want to experience those places. They get to experience them through the power of television and through sharing of that information and content. But then so many people will go and do those things because they feel like they've learned about the place and they've experienced it through the people.
The Statue of Unity in Kewadia of Sardar Patel is attracting tourism and tourists, not just from India, but across the world. And I encourage you to visit Kewadia. It is a project born out of visionary leadership of Prime Minister of India, Sri Narendra Modi. I also would encourage you, given my own experience, to visit Ran of Kutch. I've been there in Ran Festival, and I can tell you it is a unique experience which is not to be missed by anyone. So welcome to Gujarat, and welcome to Ran of Kutch Festival, and welcome to Chivona. Please enjoy this conclave, and I'm sure it will give a major boost to the connect that the diaspora, Gujarati, people of Gujarati origin here in the United States have in the state of Gujarat. Thank you very much.
Now it's time for this short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lama, and this is Vision of Asia, South Asian news segment. Let's now take a look at coronavirus updates and measures. The nation currently is surging with record number of COVID-19 deaths and hospitalizations and has overwhelmed healthcare system in states such as California, Arizona, Nevada, and Georgia. Yesterday, the nation reported a record number of 4,327 new COVID-19 deaths for the second time, bringing the current death toll to 381,000. On vaccines, the slow rollout is concerning officials nationwide, and they're shifting gears to accelerate the delivery of shots. The government is asking states to speed up COVID-19 vaccinations to people above the age of 65 and others at high risk, instead of holding back the required second dose for individuals who have received the first inoculation. States such as here in New York and our neighboring state, New Jersey, have already started expanding vaccination guidelines to include patients 65 and older. So how do medical professionals hope to speed up this vaccine rollout, and what measures should we be taking to curb the spread of COVID-19? We spoke earlier today with Dr. Rachana Kulkarni, who asked everyone to continue following CDC guidelines. Here is Dr. Kulkarni. I have some numbers that are coming in today. We are globally looking at 91.8 million cases of COVID-19 with at least 2 million deaths, nearly 2 million deaths. In the United States, we are at 22.9 million cases with at least 381,000 deaths. My question to you has to be, why are we continuing to see this surge of cases, and why can't we control it right now?
It's a very grim milestone, Aditi, that COVID-19 has become the #1 killer in the United States, surpassing heart disease and cancer. We are at this point seeing 4,000 deaths per day. It's unprecedented. And I do believe that at this point, we are paying the price for ignoring the warnings by health officials of not getting together for our holidays and having a safely distant holidays. A lot of people traveled during this holiday season between Thanksgiving and Christmas. As compared to the previous year, there was not a significant difference, considering the issues that we are facing, a pandemic that we are facing this year. People, either probably because of pandemic fatigue or overwhelming desire to see families over the weekend, over the holidays, they traveled and we got together. And that's how this extremely contagious virus spreads. All it takes is one interaction with a person with COVID-19 infection, and it spreads like a wildfire, and that's what we are seeing now.
The vaccines that are coming out from AstraZeneca and Johnson & Johnson, do you have any insight into how efficient these vaccines would be, and do you see them being added into the vaccine list that we have approved here in the US?
The efficacy, efficacy is probably not as high as the Pfizer and Moderna, but it's still very, very good. And I definitely think that they will be added to the available vaccine pool. And that's why I'm very optimistic that a big portion of the population can get vaccinated come early spring.
Dr. Kulkarni, are most doctors around you, medical professionals and healthcare workers, vaccinated right now?
A vast majority of them are. And this, Aditi, changes state by state.
Right.
So at this point, most of healthcare workers and physicians and healthcare providers, they definitely have received first dose of vaccine. Most of them will be vaccinated by end of January. And a lot of hospital systems and healthcare systems, by next week, they will open it up to first responders such as firefighters and policemen. They will be opening up the vaccine schedules. But at this point, it's limited to first responders, healthcare workers, and as I said, majority of them, and I'm speaking about New Jersey and New York, and most of them have received at least their first dose.
Well, this wraps up our show for the night. Remember to send us your suggestions and get your voices and organization on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and be well.